From the Soapbox is the official podcast for the American Animal Hospital Association's digital newsroom, Trends. Here, we take inspiration from the familiar soap notes, but instead of looking at the condition of a patient, we're diagnosing and discussing the state of the veterinary industry. We'll chat about the challenges, trends, and innovations shaping the veterinary world with voices from across the community. I'm your host, Dr. Emily Singler. Thanks for listening. Hey everyone, welcome to another episode of From the Soapbox. My guest today is Dr. Melissa Magnuson, a veterinarian and owner of 3 AAHA-accredited veterinary practices and new member of the AAHA Board of Directors. Before joining the board, one of her hospitals, Canobie Lake Animal Hospital, won AAHA-accredited Practice of the Year in 2024. We talked about what inspired her to become a practice owner, what being AAHA-accredited means to her and her team, and how she acquired her business acumen. She shared her Conscious Care program with me, a program that she created to train and support her team members both professionally and personally so that they have the tools they need to show up as their best selves at work. This program also informs how team members interact with each other and how they respond to the stresses of practice life. We also talked about the book she wrote in 2019 called Animality. There's a lot packed into this episode. So now, without further ado, getting her time to talk from the soapbox, Dr. Melissa Magnuson. Okay, Dr. Melissa Magnuson, welcome to the podcast. Thank you for joining me here.
Thank you so much for having me. I'm excited to be here.
Yeah, I'm excited to kind of dive into, there's so much stuff that you've done over the years and that you're involved in, and so many different projects and initiatives that you've been a part of. I'm excited to get to talk to you more about them and for more of our listeners to get to know some of the work that you've been doing. And we chatted a few weeks ago, so you gave me a little glimpse of some of that. But I'd love for you to start by sort of introducing yourself to our listeners and sharing whatever you would like to share of your journey, sort of your path into veterinary medicine and through veterinary medicine and to what you're doing now.
Of course. So I think Fiona wants to steal the spotlight here. She's
Love
only
it.
friendly
Cats
when we
that
have
join
Zoom.
calls.
Exactly. So I've been doing this for almost 30 years. I'm a University of Minnesota 1998 graduate, and I started a little bit later on my veterinary journey because I first worked in research. And so after I graduated from undergrad, I went and I took a position in research and development for animal vaccines. And for those listeners who may be a bit more mature, they may remember Solvay Animal Health. We were the first company that developed a feline leukemia vaccine. And sadly, my cat did not make the photo shoot for the vaccine label. I was pretty sad about that, but I was able to work on the research and development of that. And that vaccine was purchased by Fort Dodge, and then I think by maybe Boehringer or something like that. Everyone got purchased after that. But that's where I started. And then I went on to work on masters in genetics, of all things. And I sequenced the pine genome. And that's kind of boring, actually. And it was boring for me too. But what came out of that was something pretty great. And that is that I was accepted into the DVM PhD program at the University of Minnesota for vet school. And so I started in that program and started working with the pine genome working with the pig genome as well as the AKC dog genome. And so that was my start. That's how I got to veterinary school.
Awesome. So you went from plants to pigs to dogs and vaccine development, and then ended up finishing your DVM and going into clinical practice after that?
Yes, I did. And so doing a DVM and a PhD together was pretty difficult. So I ended up dropping out of the PhD program about midway. It was a lot to carry for myself, and the financial burden was becoming great on my own. And so after I graduated vet school, I went on to an internship, which brought me to the East Coast. And I completed my internship in Boston and then went into clinical practice. But clinical practice back in 1999 was a bit different than what it is today. There were no jobs, and that might be like incredibly hard to believe because today we've got such a shortage of veterinarians. Back then, I applied. I was an intern trained graduate and I applied to 9 places, had one interview, and no job offers. So that was pretty sad, and I needed to make money. So I started relief work right away. And that's how I actually met my greatest mentors. And two of my greatest mentors, one was an emergency care criticalist who taught me emergency medicine. And then the other one was a self-taught avian and exotics person. And that's my other love and passion that I started with. So that's where my basis came from. And then soon into that career of doing all the relief work and everything, I went ahead and did is I found some jobs that I fell into more permanently. But then I started a house call practice in 2000. And that house call practice was pretty successful and it took off. And I was fortunate in the fact that I had so many clients that I could open my first freestanding building. And so that's how I became a practice owner, was moving my house calls to the freestanding building. And I bought a little place, renovated it, and made my first little hospital called Canopy Lake Veterinary Hospital. And then about 4 years later, during my house call practice, I was actually using the Humane Society in Nashua, New Hampshire. I built a surgical suite there and I was doing my surgery. And they had asked me to open a hospital. So I opened another hospital in 2009. And then I purchased a third hospital in 2012. And so that's was the start of my career. And it's been ongoing.
Yeah, not too shabby at all. Starting out from a tough job market, not being able to find a job right away, to owner of free practices. That's incredible. And then you were telling me previously that you also did some side work with Mary Kay, I believe, during your graduate studies, and I think vet school too.
Yes. So and Mary Kay is one of those things. So this is not anything that's, I think, someone would expect from a veterinarian. However, I wasn't one of those people that had parents that could pay, or someone rich that I knew that could pay for vet school. I really had no money and I had to figure out some type of a job for vet school. So I met a pharmacist while I was working on my master's, and she sold Mary Kay for extra income. So I decided to do the same. And kind of the funny thing about this is that I didn't wear makeup, had no interest in skincare, but I was like, you know what? They're going to tell me what to do and I'll just follow directions. And that's exactly what I did, is I just followed their directions. And in 4 months, I had become a team leader. And then in 8 months, I became a sales director. And then I won a car. And then I went off to vet school. And so it was very lucrative for me to have this job. And then it turned out Mary Kay was one of the greatest things that could have ever happened to me for practice ownership, because when you become a sales director with Mary Kay, they send you to a training session with the Wharton School of Business, and they teach you how to run a business. And that business training was really the basis of starting my practices. And it was just so, so valuable.
That's so interesting. So do you think after that experience that you kind of knew by the time you graduated from vet school that you wanted to be a practice owner at some point?
I did. I always wanted to be a practice owner, even heading as I prior to going to vet school, I had owned a fitness studio while I was working with the uh, the Forest Service doing the pine gene mound. So I had that on the side. So I've always had kind of these side hustles and things that I was doing. So I had already owned businesses, and I liked owning businesses. Owning a business isn't for everybody, because you you get to make all the decisions. That's the great part. But the other problem is you get to make all the decisions. And so
And you get to do all the work whenever
and you get to do
whenever
all the
anybody
work
else
when no
falls
one else
through.
shows up.
Yeah.
So I think it takes a certain type of person to do that. But I did want to do that. And I really do, and I really do enjoy practice ownership.
Yeah, it sounds like you've really got that entrepreneurial spirit. The more I'm hearing about it, all the things that you've done over the years, before, during, after vet school. So, like, what do you think were the biggest lessons that you learned from your time doing the business training with Mary Kay and the work with Mary Kay that you've applied to your work as a business owner in veterinary medicine?
I think there's a couple of things. One, Mary Kay really taught me to have thick skin, because you had to go out and ask people if they wanted to have a facial or have their makeover done. And they encouraged us to go out and get 100 no's. And so you wanted to be rejected. And that piece was super valuable, as you can imagine, in the exam room when people can't complete or have financial difficulties or whatever, and they're like, no, I can't do this. And a lot of people end up feeling bad. That doesn't bother me, because I had to get 100 no's. And when you get 100 no's, that really thickens your skin, and it doesn't become about you. It's it doesn't matter. It's just a job that you're doing. And so that was one of the first things I really learned from them. But I think probably the business, and then probably the greatest thing I learned from Mary Kay, now thinking back, is uh Mary Kay Ash had uh, a saying that all sales directors and consultants would need to live their life by. And I know what people think of multi-level marketing, and they might think it's a cult, and they might think all these things, but this was really valuable information for me at the time. And I will say that I'm not really a religious person, but I'm a very spiritual person. And what Mary Kay would say is God first, family second, and career third. And so that is how she laid it out. And that's how we would work. And so if your spiritual practice needed to come first, and then your family was second, and then your career was third. So your career should never overtake those other two things. And that was a very valuable lesson, especially as a woman practice owner that had family, and I had children. I have 3 kids. They're all grown up. And I was already a veterinarian before I became a mom. And so being a mom always went harder than becoming a vet. I'll tell you that.
For sure. For sure.
And
Yeah.
so, but that really was a valuable lesson.
Yeah. No, it's certainly helpful from the standpoint of, you know, don't love the term, but work-life balance. Just this idea of perhaps some of us getting this training or this subconscious message earlier on that we should be able to put all of the rest of our needs and interests and life sort of to the side for the sake of being the best at veterinary medicine that we could be. And like the tide is really turning. I think that's no longer sort of the mainstream cultural message anymore. But it can take a
I would
lot to
agree.
unlearn that for those of us who were
Yes.
initially presented with that mindset as sort of
Hmm.
the way to be successful, um,
Yes.
the way to be quote
Absolutely.
unquote good at what you do.
Yes.
I think
100%
I'm
agree.
still working on unlearning that some of the time. And then one of your practices, I think it was Kenobi Lake Animal Hospital, was selected as AAHA Practice of the Year. And was it 2024?
Yes, 2024. Yes, that was one of the biggest honors I have. I didn't even know about AHA, which is rather funny. And I talked about it when I accepted the award for the practice of the year. I learned about AHA my senior year of vet school because I won the AHA award. And I was like, what is this? And our school had an AHA student award. And so I won it, and they gave me a, uh, I guess, a voucher to go to an AHA conference. And so that's where I learned about AHA, and I learned about the standards, and I learned about everything that AHA had to offer. And I wanted to be a practice owner. So I was like, this is fantastic. I was like, this conference, it was free and I had no money, so that was great. And I learned everything about opening a veterinary hospital and doing it the right way. And so my journey was truly from the beginning. I went to that conference my first year out and learned about AHA. And then when I opened my practices, I immediately said, I'm going to be AHA accredited. So I opened my practice in December of 2005. And then we were accredited at the end of it was like the end of, I think it was the beginning of 2007 or something like that. So we've been accredited for almost 20 years. And all three of my hospitals are accredited. And I'm super proud of that because AHA has always provided this kind of scaffolding for veterinarians to grow and do great things. And I feel so fortunate that I was introduced to it in the very beginning. And so that I could kind of ride the wave. It's been great.
Yeah, I love that you've been a member for so long, and that you went from not knowing what AHA was or anything about it to just knowing that that was part of going to be part of your path forward. So what was it like for your hospital to win Practice of the Year?
It was very exciting. We had been invited to apply before, I think 4 years prior, and we were one of the 4 finalists and we didn't win. And so then we got asked to apply again, and so we did. And my practice managers came with me. So my 3 practice managers from all 3 of my hospitals came with me. And when we won, it was so exciting because we really drew we live and breathe AHA and do everything. And we train on it weekly. Since how I actually um, became accredited is an interesting story because I decided to close every Wednesday from 12 to 2 to work on AHA standards. And what I did, I had 5, I think, I think I had 4 employees. There were 5 of us. And we would just separate up the standards and we worked on them together. And we said, Tammy, you do this, Julie, do this. I would do this. And then we would come together and we instituted them. And it took over a year, but that was for closing 2 hours every day on a Wednesday. We still do that. And of course, we're not working to be accredited, but we're still, it's an important part of our culture that every week we close for that 2 hours. We come together. There's team connection, there's team building, there's, you know, reinforcing the standards, learning the new standards, like, for instance, the new feline diabetes guidelines. What a hit. My doctor's so excited. And so we just went over that. I think it was maybe 2 weeks ago, and introduced it at our rounds, that 2 hours that we close now. And so it's been such a great thing from where we came, that's stayed on. And then we're still doing AHA and using all of their resources to make us, better veterinarians.
Oh, I'm glad to get that feedback, to know that
Mm.
the guidelines. So I just
Mm.
interviewed Dr. Ingrid Taylor, the director of
Yeah.
guidelines, on the previous episode of the podcast. So, and I know she's very proud of them and all the work that all the task force members and everyone involved has put into them. So, she'll be happy to hear the feedback from your
Yes, and she
team.
should be very proud of them. Everybody who worked on them did a wonderful job, and they're very good, and we're highly needed because as you know, diabetes, it doesn't it doesn't come in a nice little package box and say, here, this is how you're going to handle me. They're all a little
No,
bit
it does
different.
not. No, it does not. We also recently had Dr. Renee Rosinski, who was on the task force guidelines on, and she said some really amazing things though, and just all of the advancements that have been made with diabetes management, particularly in cats, and talking about SGLT2 inhibitor drugs and how in cats that can take them, it could turn diabetes into, she called it, a boring disease. And I mean,
Yes.
that's so exciting. You talk about like things not coming in a box. If we can maybe like put it in a box, put
Put it in a
it in a
box.
box,
Get
shut the door, to close the box.
exactly.
Um, you know,
Becomes a lot easier and
dream
manageable.
come true. Yeah.
Yeah.
Um, so yes, I agree. Very, very important work. And I love that you get your whole team involved in really studying the standards, studying the guidelines, presenting it to each other, and deciding, I imagine coming up with ideas of how to implement what you're going over and what you're learning. Is that kind of how you guys do it?
Yeah, exactly. We actually involve everyone. And so, even from our front desk staff, the doctors, techs, assistants, even to our kennel assistants, everyone is involved in these rounds and they're there and they're learning because I think it's so valuable for they may not understand the complexity of it like the doctors do, of course, but to hear the information and then they can talk to clients about it. Yes, the doctors review these guidelines with us. We understand it, and you know, it really elevates the level of practice that you can do because your team members come to understand what we actually learned during this session that we had is that many of our team members did not know what diabetes meant. Like they didn't know that, the blood sugar needs to be high and we need to find it in the urine. And so we had a couple of team members say, "Oh, is that why you always have them bring in a urine?" And it's like, it's clicking. And so it's good for people to know that because then your team members can be one step ahead of you, right? And so if we're getting the blood work in and say, "I think this may be diabetes," they'll say, "Oh, I'll have them drop off a urine. Let me get them a urine cup." And your job becomes easier.
Yeah.
And so the more you can involve the team in understanding the basics, I really think it's really beneficial to everybody.
That's such an important point because they can, like you said, kind of take that initiative, get things going, and they can also echo your recommendations. And we all know that other team members are going to get asked questions about the things that we've discussed with them after we leave the room. And if they're more
Mhm.
confident in being able to answer some of those questions, I think that's going to hugely impact sort of trust and sort of the impact that the message that the recommendations have as those clients walk out of the practice. Um, so
Definitely.
I think that's such a great example that other teams, I'm sure other teams are doing something similar, but I love that example and thank you for sharing that. And now you have deepened your relationship with AHA and you're now a member of the board of directors.
Yes, I am. And
Yeah.
I'm so proud to be a part of the board of directors and the great people that are on the board. I just started in September and it has been a wonderful journey.
And what made you decide to pursue that?
So it was mostly it I had some one once we won the AHA Practice of the Year award, and I had the board members congratulate me, and I was talking to them, and they said, "You should really apply. You should look into this." And so I did. I wasn't quite sure if I wanted to do it or not, but the more I thought about it, and the more I researched it, looked into it, I thought, I've been doing this a long time, and I have a lot of um, knowledge, which I think can help the profession overall. And I think it's a great way to give back because there are, right now, as you know, in our profession, there's a lot of overwhelm, there's a lot of um, cognitive overload and burnout and those kinds of things. And I have been pretty fortunate myself not to succumb to a lot of those things. I think because I realize the boundaries that I need to set. And so if I can give back to this profession in any way and help even just one veterinarian, that's going to be really, I think that's our job to do. If you can help others, it's a really wonderful goal to have. And that's why I ended up really truly joining the board, is I want to give back to this profession. It's given me so much, um, so much joy, and it's been such a wonderful ride. And I would like others to and enjoy it as much as I do, which I don't know if it's possible, but but I'd love to see that.
Well, I think your excitement is contagious, infectious. The way you share it, it's very genuine. So, I'm sure others will see that, and we're certainly very happy to have you on the board and all the board members and the dedication that they all bring to the practice of veterinary medicine and AAHA's mission, and all of the veterinary professionals who want to make this profession the best that it can be for the sake of our patients and their families. So, yeah, I thank you for the work that you do, and um, I'm glad that you bring so much excitement and passion to it, because I think that's definitely what's needed.
Well, thank you.
Yeah, and
Especially go ahead.
no, please.
I was going to say, especially for an introvert. So I usually,
Yes.
we talked about that, how so many of us are introverts, and this profession isn't always the easiest thing to do. But, you know, I've been able to kind of find my niche, and it's been great.
Yeah, solidarity here. The introverts unite. We sort of bonded over that the last time we were having our prep call. So I'm a fellow introvert. I'm a fellow combined VMD, PhD dropout as well. So you're not alone
Yay.
on either of those
Yay.
counts. Um, and sometimes it is hard to, not just because of introversion, although introversion can be part of it, to kind of like step up and be like, okay, I'm gonna voice my opinion. I'm gonna be a leader. I'm gonna, um, have trust myself and my expertise, and that I have something valuable to bring, and I want to share that with others. I mean, that's hard, I think, for anybody, and that added level of being kind of an introvert, which not all of us are in veterinary medicine, but certainly you and I are not the only ones. Um,
We are not the only ones.
yeah, that can be very challenging. And not to mention that you're so busy, um, running your practices and seeing patients and managing the rest of your life, to add another responsibility on top of that. So, and that's true for all those in our profession who, participate in organized veterinary medicine in whatever way that they do, and community involvement or whatever they do outside of their day job. It's hard to do that. So definitely, shout out to those who find ways to make that happen, because they're part of the reason so many great things happen in our profession. Yeah. And I wanted to talk with you about one of the things that you do with your one of the programs that you have with your staff, the conscious care program
Yes.
that you've created.
Yes.
Can you talk about that?
Of course. And this is one of the big reasons why I believe we were the recipients of the 2024 AHA Practice of the Year, was because of my conscious care program. It's something I'm super proud about. So it is a trademark program, and it has 5 pillars. And the first pillar is self-care. And it's all about taking care of yourself, because if you can't show up for yourself, you really can't show up for others. And that means you can't show up for your team members, your patients, or the clients that you're serving. And so we teach on that. What does self-care mean? And it's not necessarily, going home and taking a bath or listening to music. That's a really small part of it, but it's how you show up for yourself. You love yourself, and doing the important things to truly take care of yourself. We break that down. The second pillar is team care. And so once you understand how you need to show up for yourself, and you can start showing up for others within the hospital. And one of the things that conscious care is based on is I based it on something called the 15 Commitments to Conscious Leadership. It's my favorite book of all time. And these commitments actually talk about basically how you show up for yourself and others. And their whole premise is you draw a black line, and you can either be above the line or you can be below the line. And the premise of it is it's not necessarily that you're above the line or below the line. It's that you know where you're at. And that's a really important concept. And so, for instance, if you're above the line, you are committed to learning and being curious, which we talk about a lot in our hospitals. And if you're below the line, you're committed to being right. And as a bunch of type A personalities, uh, we're always right. And so it's really easy to be below the line, and it's okay to be below the line. That's the thing. But you need to realize that you're there. And that's where that self awareness piece really comes in. And so our team members, especially when we're talking about the team care portion of conscious care, is we will be talking about, say they come out of exam room 2 and they're like, oh my gosh, I cannot believe that woman in exam room 2, she's being so ridiculous. And another person may jump on and say, oh yeah, I've had a client like that. They're terrible. And we have team leads within our organizations, and they'll call people out, and they won't say, you shouldn't say that. It's not like that. They're like, where are you right now? And they'll say, oh, we're totally below the line. You're right. We should really, and then they stop and they think usually, and they're like, okay, how could I be curious about this? Why would this woman maybe be this way? Well, she's really stressed because her cat, it's a fractious cat. It took her extra time to get here. It peed and pooped all over the carrier. Okay, so that makes sense. If I brought in my cat and it peed and pooped everywhere, I'd be pretty cranky too. And so it gets them to really think about where they are. And when you can come from this different angle, it makes a big difference. And so people don't feel like they're being called out on having, say, poor behavior. They're just having a behavior because they're currently below the line. They're really stuck in being right. And, everyone should be like me. And we forget to elevate and shift and try to be above the line. And there are days, we have all had them. I'm sure you've had them too, where,
Undoubtedly.
nothing seemed to go.
Undoubtedly.
And you're losing it at the end of the day. And we have we'll see doctors, kind of shaking their heads like, yeah, I'm below the line. I'm staying here because I've had it. Like, I am done. And that's okay too, because, there's only so much we can carry. Our buckets get empty, and we have to realize that. When the bucket's empty, the bucket's empty, and you can't give from an empty bucket. And the more we can talk about these things and realize that it's okay to be overwhelmed sometimes. It's okay to feel like I don't have any more to give and my brain shut off and I can't form a sentence right now. That's okay. That's when you have to kind of reach out to that village and, look for that help. And so that's a team care portion. The other 3 portions are the patient care is another pillar, which we come from patient care from a little bit different angle. We talk about grounding ourselves because ask anyone in my hospitals, if anyone knows you're anxious, who is it? They're like, the animals. And I'm
Animal.
like,
Yeah.
yeah, that's it. And so we talk about patient care from a little bit different perspective. Of course, we talk about client care, a lot of client communication. We have a whole method of acknowledging and educating and resolving and going through the steps on how we talk to clients. It really has elevated our practice. And then finally, community. How do we show up in our communities? So those are the 5 pillars. That's what we work on. That's part of that 2 hours that I talked about earlier. There's always a conscious care component that we have within there. And it just helps build a really, I'll say, stable culture. Nobody's culture is perfect. That's impossible. It's just it's to have, you're going to have these ebbs and waves, and sometimes you're going to be on that top of the wave and sometimes you're going to fall off, and it's okay. You just need to be able to know, why and where you're there, and what you can do about it.
Yeah, that's I love that. There are so many elements of that that really speak to me, and in particular, just this idea of um, acknowledging and awareness, but without judgment, without shame. That you're teaching your team members to practice that for themselves, which then I imagine. I'm sure it's explicitly taught as well, but I imagine just by extension, it also um, affects the way that they treat others. Just the fact that they're taught to ask, not like, what is wrong with you? Or why are you saying that? Or, don't talk that way. Just say like, hey, what's going on with you right now? Where are you? Um, and as a very gentle call out. And I imagine that affects the way they then interact with clients when they see like, can you tell me maybe what's coming up for you, or you know, what are your thoughts are as we discuss this treatment plan? Or, I mean,
Yes.
do you see that?
Yes, exactly. And I developed the program purposefully for that, because I felt as if we can show up for ourselves, we can then learn with our team members. This is a bit more safe environment than learning with a client, because most, the team members, you may not like a team member one day because what they did, but generally we're all liking our team members. And it's a little bit easier, I think, to show up for these team members and practice these things. And that's what we do. We practice these methods. And then it definitely applies to clients. And so we will have, it's not unusual for my doctors or, other team members will be asking the team leads and things like that. I have a client in room 2. She's mad. And they're like, okay, let's break it down. Like, what exactly happened? And then a lot of times the client's not even mad. It's the perception of the team member, because they're just not connecting on what maybe the client wants. Maybe the client wants a nail trim, but the doctor had said, no, let's wait until we can sedate. It's going to be easier on the patient, whatever. And the owner just doesn't understand, or something like that. And
Mm-hmm.
and how do we navigate that? Because you and I know, as doctors, we go in, we say our spiel, and then the client will turn around and say something else to the team member, and it's like, I already went over that. And so things can get flipped, and it's learning how to navigate those situations. So when you first can navigate them with your team members, and you can practice it, and then you know what to say, you can then apply it to the clients, and and hopefully it works. I always tell people, you're shooting for a B. We are not going to ace every client conversation every time, because clients are pretty dynamic, and that's why they call it practice, because you never know what curveball they're going to throw you, and sometimes they're doozies, and you might not get it right this time, but we can keep practicing. That's the cool part, and we'll just keep getting better and better at it.
Well, that's a nice way to take a little bit of the pressure off shooting for bees. That's probably going to take some getting used to for a lot of veterinary professionals, but um,
It is definitely. The Brene Brown, The Gifts of Imperfection, one of my favorite books. That's a good one, because we have to remember that, being this type A, got to get an A on the exam, have to got to be the first, got to be the top. It's bees are good.
yeah,
Sometimes I have C days.
yeah. As a mom now, it's you think about the messages that you impart to your children and how you want them to see themselves, and how what you say to them affects how they see themselves. I imagine it's a similar feeling as a business owner and as a leader where so many people look to you. what kind of message are you going to give them that they're going to then go and incorporate into the way they see themselves and the way they show up in the world. So, yes, very important.
Yes. Yes. And I'm glad you brought that up because so being a mom, being a practice owner, one of the things that, so being a veterinarian, I thought, so for me, I grew up on a farm. And so I was always around animals and I knew how to read animals. I was really good at it because we had pigs, cows, cats, dogs. I would, go get strays and, get in trouble. But I just loved all these animals, but I knew how to interact with them. And then when I had kids, that was hard. I didn't really know how to interact with them, but because they were a lot harder than animals.
They
Way
are a
harder
lot
than
harder
pets.
than animals.
Super hard. And so, but I kept thinking about how do I show up for the animals? Because that was my frame of reference. And I was good at that. I could show up for the animals and I'd be like, okay, if I can show up for these animals, then I can show up for people too. This is all my introversion at work because as an introvert, we get all of our energy when we're alone and we're kind of refueling up, where when you're with those people all day, whether it's your kids or clients or team members, whoever it is, that takes all that energy out of you. So what I had learned is, I just have to keep going back to what have the animals taught me and how have they taught me to be grounded, because oh my gosh, my animals are always grounded. Like they're always showing up for me. I come home, my cat and my dog are at the door. They're like, hey, how was your day? They're so interested. And they've got it together. And so that's kind of how, that's a big portion of how I work on grounding myself is I'm like, okay, I'm gonna be like my cat Fiona today, who's, she's finally jumped down and relaxing, but she's just happy to be here.
She was like, I'm going to be on a podcast today. I don't know what the issue is.
Exactly.
This is my moment. So, yeah, animals are usually, they're not, what's the word I'm trying to think of? They're unapologetic. They're like, this is what I do and I'm going to do it,
Mhm.
kind
Yep.
of thing. So, we definitely learn a thing or two from that. Speaking of which, you
Completely.
talked about some books and the animals, and you also wrote a book,
I did.
Animality.
Animality. Yes. My husband came up with
Tell
the
us.
title. I liked it. And it's how pets and people connect. And so it's a collection of stories. I think I self-published it in 2019, just before 2020 hit. And it's all about kind of my journeys in my exam rooms with my clients and what I learned from them. I really truly believe that our clients and our patients are our greatest teachers, and they'll make you or they'll break you as a veterinarian. And if you start to embrace them, a shout out to Dr. Andy Rourke, who really helped me. He said, before I walk into every room, I pretend that my best friend's on the other side of the door. And I was like, oh, I'll do that. And that really, really helped me. And so when I thought about, my best friend was there, I wanted to help my best friend. Who doesn't want to help their best friend?
Yeah.
Of
Nobody.
course. And so I would do that. And I started to really embrace that everything the client had to say was an opportunity for me to learn. And every time, a cat, a dog, and I see exotics, so birds, rabbits, whatever they're going to throw at me, even if it is abnormal, crazy, whatever, I'm learning. And I just became really authentic about that. And people would say, "Oh, have you ever seen this before?" And sometimes I'm like, "Absolutely not. Never seen it before." But I have colleagues that maybe have, and I've got Vin, and I've got, my mentors, and I'm going to look it up and I'm going to get back to you because I have no idea, but that doesn't mean that we can't work on it together. And so I try to always make it a team event with my client and the patient and me, and get to the common goal. But that has been that has really been a journey for me to to really learn from my patients and my clients. And that's all contained within my book.
That sounds very interesting. And I was just gonna say, like, having experienced this myself, like it's I don't know, freeing is the word that comes to mind, but like there's a certain sense of like confidence that you need to gain to be able to tell someone that you don't know the answer. Because I think
Yes.
when you're like really new and you're like I guess I shouldn't speak for others, but for myself, I was embarrassed that I didn't know. I didn't want
Mm-hmm.
others to know how much I didn't know because I felt like there was something wrong with me, and I was kind of like
Yeah.
ashamed about all the stuff that I didn't know. And maybe that's not the experience that others have, but that was my experience. Um, and so that was like the worst thing in the world that I could do is tell someone like I don't know because it was just
Mm-hmm.
this like reminder to me. Uh, I don't know. I should know. Like, what's wrong with me? Like, I haven't had this experience. I'm inexperienced. But then, you go along and you think, well, there's no way I'm going to know everything. There's no way I'm going to have done everything. And no one expects me really to have. They just would like you to be transparent and honest with them. And maybe if you tell someone I've never done this before, they're going to be like, okay, I'd like to go see someone else who has done this before. More power to them. I don't think any of us would ever argue with that, uh,
No.
or hopefully not feel bad about ourselves about that. But there's a point where, like, I don't know, maybe some reached this sooner than I did, where not that I ever lied about it, but I felt bad saying it. Where, I got to a point where I'm like, you know what, I haven't. People say, have you seen a case exactly like this before? And I'll be like, no, I haven't.
Yeah.
I
And
haven't.
I think you're right. There's the shame and the judgment in that of like, oh my gosh, I have to show up and I got to be the doctor. I have to know everything. And I always tell even my new grads, I tell them, I'm like, you're the smartest person in the room.
Yeah.
They didn't go to vet school. And I said, and honest to God, this is a true statement. I've only had, I think, once have someone in the room who I really felt was way, way smarter than me. And he was the anesthesiologist at the head of Mass General. And we were talking about anesthesia.
Oh, I think we all have a story like that. I had one with a dog with cataracts, and I'm explaining cataract surgery, and then the guy is like a human ophthalmologist, and I'm like,
Yes.
You explain it to me then, because
Yeah,
I'm
exactly. Because
gonna
you're
stop
gonna know it
now."
better. Exactly. And that's the thing, but it's so rare. I mean, here I am, like 28 years and I've had it one time that I really felt like, oh yeah, this guy, I can't explain anesthesia to him. It's silly.
But I'm sure that person was there to see you, and I'm sure they still really respected you and felt like you were the one who was the expert on providing anesthesia to their pet.
Of course.
It can be
Absolutely. Because
hard to remember that in the moment. The
yeah,
vast majority of the time, even when we're with someone who is very much an expert in their own right, they have come to see you. They've come to make that decision to be there instead of trying to do some cowboy version
something
of
at home.
whatever they would do, at home. Um, so yeah, that trust and respect is still there. But yeah, thank you. Thank you for sharing those experiences. Hopefully that helps others who've been in those types of experiences to know that they're not alone and it happens,
They are
I
not
think, to all
alone.
of
Oh
us.
man. Yeah, there's so many experiences. I sometimes, my team members will remember them and I'm like, "Oh yeah." I'm like, that was a doozy, wasn't it?" Like, there's so many things and that was kind of my I really wanted to write the book because, and in vet med there's crazy things that happen.
Oh yeah.
Um it is truly a reality TV show some days. It's just like one of my doctors that worked for me, she no longer works for me anymore. But she was awesome. She always used to say, "You can't get this at Walmart." And it's make me laugh because Walmart has everything, but
That's so
not
true.
at the vet hospital.
That's so
You can't get
true.
this at Walmart.
All the things that we've seen, that we've heard, that we've been told that sometimes we wish we didn't know.
Yes.
But we're that trusted person in the room who
We are.
is going to be the receiver of that
Yes.
in that moment. But
Absolutely.
it is an honor to be there for people and their pets in those moments, even if they're, very vulnerable and things that we never could have imagined we would hear about or that would happen, that we're suddenly there as a witness to it. So I think we have to laugh about it, to kind of get through it.
Yeah. That's
But
you
it
have
is,
to. I mean,
yeah.
I know sometimes it's just I think you have to find humor. I always tell people, if you can't find humor in yourself, then it's going to be really hard to find humor with others. And because we do, like, I've just done so many silly things sometimes, and my text will call me out on it. I'm like, oh yeah, that was a really bad idea. But if in the moment it sounded really good. But, but this is how we grow, and this is how we learn from our mistakes, is to do kind of these silly things. I remember there was a Malamute that needed to be sedated because it couldn't be touched, of course. And he was really, really painful. And I had this really great idea that the owners didn't want to sedate. And he wasn't necessarily fractious, like he wasn't biting. He was just an idiot. And I was like, oh, I think we'll be okay. I think we'll be okay. And I brought in 2 technicians, and it literally was like a wrestling match. And I was watching it and I'm like, stop. This
Those
was
are
a
famous
bad
last
idea.
words. I think you'll be okay.
I
Yeah,
think it'll be okay.
that reminds me of a case where we had this cat who pretty much always had to be sedated every time. Like, he would come in on gabapentin and it was never enough, and so we would have to use general anesthesia. And he was getting older, and I can't remember why he was coming in, but the owner was saying, like, he's particularly sedate on the gabapentin today. She's like, you guys can do whatever you want, but like, he just seems like he's not growling, he's not hissing, he's not swatting, he's not doing any of the things he would normally do on the gabapentin. And so we're like, well, let's see how far we get, kind of thing. And so it was an exam. It wasn't like we were, and I think at the end she wanted a nail trim. It was, kind of like, if you can. And so the whole exam, he did not, like, he was like a rag doll. Like, he didn't move. He didn't make any noise. He wasn't tense. He was very, like, he was just kind of floppy, like, kind of sleepy. Let us do what we needed to do. And I thought, okay, well, maybe, he's getting older. He's just, he knows the drill. The GABA is really working well for him. This is good. I'm glad we like try to do things as quietly and as smoothly as we can, and get him in and get him home, and hopefully it'll be a better experience. And so, of course, it was during the nail trim, we had done everything else where it was like nail number 4, okay, nail number 5, absolutely not, like that. Suddenly, like, different
It
mode
goes south.
activated, and he swatted at me, and the owner and the tech were right there, and his claw became like lodged in my hand, like lodged, like
Oh no.
we couldn't pull it out, we couldn't get it out.
Oh no.
And the tech was holding the cat, and he's like, if I let go of him to try to help you, I think he will bite you because he's stuck to you.
Yeah.
And he
Because
wants to
he's
be
one with
free
you
from
now.
you. And we don't dare ask the client to do anything. And she's like, I don't know what to do. She's scared. And I'm like, please don't let go of him, because I do think he will bite me. Because now he was growling. Yeah. I'm like, have one hand where I'm like trying to like work this.
Try it out.
So I ended up reaching behind me and doing some kind of like gymnastics maneuver to get the. Oh no, we weren't even clipping nails. That's what it was. We were not clipping nails. We were just about to be done with him, and like finding the nail trimmers in the drawer behind me. And that was how I freed myself, was by cutting.
You cut the nail?
I cut the nail.
No, sir. So you just had the nail in your hand?
I had the nail in my hand, but no longer the rest of the cat. And meanwhile, the client is going, I'm so sorry. I'm so sorry. I'm so sorry. I'm like, "It's not your fault. You didn't ask us to do this." And I was kind of like glad that the owner saw it, not because I wanted her to feel bad, but just because like you wouldn't believe it if you didn't see it kind of thing.
Well, exactly.
Like and I was like the whole time I'm like, this is so stupid. Why did I do this? Like, why did I
Yeah.
believe that
Oh,
this
yeah.
cat was gonna be, was gonna tolerate this? It's not his fault, but we know him. We know better.
Yep.
Um,
We know better.
and so like
But
I
we'll
was like
just try.
saved by the nail trimmer that I was able to like grab with my left hand. But
Wow. That's pretty
um
impressive.
yeah, because it's one of those like, I think it'll be okay kind
I
of
think it'll be
things that you
okay.
always sort of live to regret later. But
I hope you saved that nail. Did you put it like on a necklace or
oh my
something?
gosh, no. No, I did not. Did some deep lavage of the palm of my hand after I removed it.
Oh my
Told myself
gosh.
never again.
Not going to do that again. Not
Not
going to be sucked into the fractious cat story. Oh,
yes.
I've been there.
Well, yeah. I mean, those are the stories, and we laugh about them, and hopefully that just gets us through the next day and helps us bond with each
Ex-
other, and we learn something
exactly.
hopefully. Um, but yeah, so
Exactly.
I appreciate you um bringing up your own memories and helping me relive some of
Mhm.
mine because I think
Of
that's an
course.
important part of our collegiality. I think in
It is.
this profession.
It is. The stories we share, I think it's that true connection that we can have with one another, and it's vital and it's important.
Yeah, yeah. Well, I've really enjoyed this conversation with you, and I want to make sure that I get this question in because I like to ask everybody. So I'd love if you would share one thing that you're excited about in veterinary medicine, either something that's happening now or something you're excited about for the future.
Ooh, this is a good one because I'm always looking for the next greatest and wonderful thing in vet med to make my life easier. And so I am, and this might get some people a little wound up, but I am like obsessed with AI. I took an AI mastery course for 9 months, and I have been using AI to really get rid of the repetitive things in our hospitals. So, the mundane ridiculousness that we do over and over and over again. And it has elevated our practices and made our lives easier, which is so important. And so AI is probably the one of the biggest things. AI really can change your life in this profession because I really feel as if cognitive overload is a lot for us because there's very few professions where you're the general practitioner, you're the internist, you're the dentist, you're the surgeon, you're the mortician, you're the grief counselor, you're all day long the psychologist, and
Yeah,
occasionally you have to be the banker and financier and explain all those things. And it's a lot.
yeah.
Like that's a lot. And if you get that case that you have to hit all of those buttons, man, oh man, you're tired. And so AI is paving the way for me to kind of unload a lot of these things, and it's been really great.
Yeah, I think it's a common answer, and I think in veterinary medicine we think a lot about like AI scribe technology, but I'm sure that is just the very tip of the iceberg on how
I think it is. I mean,
AI.
I love AI spread. It's great. But there's so much more, and there's so much more we can do to make our lives more boundaried and 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 be able to put that work-life balance in. And it, whether you want to call it a balance or not, is really not a balance, but just to be able to have life,
Yeah,
beyond work.
yeah,
So
love that, love that. Any final thoughts that you'd like to share with our listeners today, or any ways you'd like to share for them to follow along with all the things that you're doing?
yeah, I'm on the consciousvet.com. You can see me on there, and that's my website. We're doing an overhaul of it right now. This is completely my side hustle, and so it's not flashy yet. It'll get there. But and I'm also on Facebook and Instagram, the Conscious Vet, and yeah, that's where I'm at.
Thanks so much for spending time with me today.
Yes, thank you so much, Emily. This was great.